thank you. Hello, my name is David Hamilton. I would like to just give a little bit of a brief background before we dive in, and I want to make sure that I can also get my slides up here. Give me 1 second.
And I think Dr. Oscar will introduce you and your presentation.
I will just say a few words, but you're welcome, David, to complement what I'm going to be saying based on your feedback. So you are a highly analytical and innovative visionary leader with extensive experience developing, deploying, and maintaining systems, methods, and processes for business transformation, informatics, analytics, and report automation in pharmaceutical environments. That's a lot. Influencer with consistent track record of delivering high-level organizational efficiencies through innovation, data informatics, and collaboration ideation. Known for building high-performing teams and implementing high-impact solutions through thought leadership, effective strategy insights, team leadership communication, and effective negotiations. And you're going to give us a very interesting talk about innovation to disruption, the underestimation of a profound shift. Go ahead, the floor is yours, David.
Thank you so much, and I apologize. I'm just looking for my share screen button. I'm not seeing, oh, there it is, okay. Just give me 1 second while I get my screen up, and then we can take it away. Okay, and just tell me when you can see my screen, and I can go from there.
Yes, we can see your PowerPoint, the first slide.
Okay, and just give me a second to change the view. Here, let's get rid of the notes and normal line. Okay, right in. Okay. So thank you for that introduction. It is certainly a pleasure to be here, and I welcome some interactive thoughts and comments. I would like to hear from some of you as we go through. As it has been mentioned, I have worked on designing a number of different platforms in pharmaceutical industry, rolling them out both from within pharma and also from the exterior. Recently, I have started Biopharmatics within the past year and launched this new company to help provide service to pharmaceutical companies and also help with design thinking, creation of platforms, and strategic perspectives for obtaining digital transformation. Now, I know that's a lot, but what I'm going to talk to today is about the perspective of profound shifts, the roadmap from going from innovation to disruption, and I'm going to go through this in a bit. So we're going to dive right in here. First, just to talk about disruption from a high level. This was something I had recently seen from Tony Seba from Rethink X, and I just really thought it was fit for purpose as I was going through what I was going to talk about today. I saw this, and he was talking about oftentimes our forecasting of change and the possibility of change in the future is rooted in our current constraints of today. There's a lot of thought that maybe things can shift, but slightly, or maybe over time with enough time that there'll be a shift in adoption, and eventually what might be, for instance, a very small percentage today could go up a few points, or maybe get an early majority in some time. But as Tony was speaking on energy, he was showing how profound the shift happens, how quickly it happens. And I think the same is happening in pharma. And I'm just using this one case here as an example of shale gas production and the underestimation over time.
And sorry, David, David, to cut you off. It looks like your slides are not advancing. If you just want to go back to your PowerPoint and click on each slide.
Can you see this change here?
Currently, we are stuck on the... The second one, yeah, historical perspectives. Yeah.
Okay. So I see the change here. Let me see if I can bring this down here. This might help. And there, is that better? See the slide change here. Okay, thank you. So the concept is that disruption does not happen in incremental steps. It really happens in more of a sinusoidal adoption. And there are sudden shifts that occur. And what I'm going to speak to you today about is really how this is happening already in pharma and how we oftentimes go through challenges in the hype cycle, et cetera. But this is an important thing to keep in mind as we proceed forward. So much is changing and so much is happening, but oftentimes we feel like everything's the same. So first, to understand where we go with disruption, it's important to know that innovation comes from really good design thinking, and design thinking centered on a combination of technology, of business viability, and really usability from a people perspective, the UI UX. And it's important to have all three of these components integrated to get really good innovation to proceed forward. Oftentimes innovation runs into challenges because of leaving out one of these components and ending up with really great technologically savvy implementations that are requested by the business, but they're completely unusable for the people who they serve. And likewise, many businesses today are operating on a low-tech approach using highly robust standardized methods, just like Excel and Word and other types of approaches to get things done. But in the end, it's the combination of all three that really helps to engage new capabilities to open up and create something that's scalable and can impact on a high level. With that being said, there is the process of adoption that is required to go from innovation to disruption. Innovation starts at the early end. A lot of you may have seen this, but it's talking about really how this shifts from one area to another, from early innovation to middle stage adoption, where you get the early majority coming up and really taking things on. Now, it's important to talk about going from innovation to even early adoption. Many people are looking for change and want to be a part of it. These early adopters and innovators are actively promoting it. They're working to define it. They're not afraid of rough estimations or approximations, kind of like beta models or prototypes. You know, they're getting their hands dirty and willing to do that. Whereas the early majority is looking for things to be worked out. They don't want to adopt too early. They want to see some of the bugs out of the system first before they get on board. And that's a really important shift point, is they're kind of watching. Right? There's this early majority, well, you know, I see decentralized trials. I see a lot of interest in doing these different things, but let's see it shake out a bit more before we get on board. Whereas the late majority is doing business as is. You know, they will get involved once there's a clear benefit and there's really good social momentum or incentives to jump in. And oftentimes they're driven by fear of missing out. You know, oh, everyone's starting to do this. Let me hop on board too. And finally get to this latent group, which are called oftentimes the laggards, very highly reluctant to change and adverse to change, and will adopt only when forced. It's important to cover the different perspectives in these groups and understand, you know, it's okay to be part of the late majority. Maybe you just are very settled in your work, you know how you work well, and you don't want to really change that too readily. And so you kind of continue in a certain pattern and way of being. Now, getting through that, you have to understand also that convergence and emergence promotes momentum. Now, what does this mean? Convergence is like what I call the constellation effect, a series of different technological changes or advancements. Either it's an advancement in capability, whether you think about instrumentation and measurements and what we can do with imaging today that we couldn't a while ago, or you think about biomarkers and some of the advancements in genomics and transcriptomics. There's a lot that's happening in different places. And so when the dots are connected, it's like creating a constellation. A new constellation appears. And out of that new constellation comes a whole new platform of capability. Versus emergence, which is like the deepening of understanding on something we've already had good perspective on. And so you can imagine like exploring Mars. We've known Mars is there for a while, but now we're putting a helicopter drone on Mars and we're going to fly it around and take pictures. So that's like almost like emergence. We're expanding our view of what we've seen before, and something is emerging out of that.
Yeah. It looks like, Dave, your slides are stuck on number 2, historical perspective.
Historical perspective, not changed?
No.
Okay.
It's on number 2.
It's on number 2. All right, let's see if I can help this change in some way. Okay, give me a second. I apologize. Okay, you can see it here, but it's not coming. Okay, maybe if I were to do this, this would help. So let's hide my ribbon. Okay, so here's innovation from good design thinking. And just to kind of talk through, right, this is important to have an overlap of all 3 of these pieces. Here is the adoption curve, which I was talking about, the different groups of adoption. And this is changing on your end now, correct?
Yes, it's.
Okay, I think my presentation mode may have messed with the screen share. All right, and this again, to this point, there's a transition from early adopters into the early majority, and this is an important point on the curve. You'll see an arrow there. Now I'm on the slide of convergence and emergence and talking about the constellation effect versus exploration and emergence in an area that may have been known or understood, but maybe perhaps not effective or not enough information there yet. Versus convergence, which is really the aligning of different types of technology or different types of changes that work together to unlock something new. Now, why are these differences important? Well, they drive momentum. When you have convergence, when in certain key areas, you think about mobile technology, you think about COVID, and all of the things we've experienced in the past year. There's been a serious momentum shift in the adoption and the willingness to engage in telehealth, to engage in remote visits and monitoring and home nursing. All of these things have really amped up the momentum. And that's important because for adoption, you have to have momentum to cross the chasm where you get from early innovation and early adopters and into that early majority where you get maybe the first third start to really dive in and take on the new as normal. And so you think about now remote visits. Well, that box has now been opened. People are now exploring this from a number of different angles. Companies are starting to pop up all over the place. Oh, we'll do home health nursing. We'll come to your door. We'll do home infusions. I've seen home blood collections. People willing to centrifuge blood in other people's homes. That was unthinkable about 2 years ago. And now today, this is something that is now being seriously considered. And actually, we're getting some of these early leaps across this chasm in certain areas. But there's more than just crossing the chasm. It goes further. However, we do have the reality of where are we at today. And many of you have heard so many new advances and things that are happening and probably are still wondering, disruption in pharma? What? Innovation is challenging enough. We've got all these systems and ways of doing things. We've got technical debt, system debt. We can't change easily enough. Maybe we think that regulatory accommodations are not there, when sometimes they are amenable. Organizations can have varying degrees of data literacy, and that's an important factor for being a bit more agile and adopting new innovation, especially around data. We face organizational limitations where sometimes there's silos of innovation, but it's not widespread across organization, or not everyone has equal access. There can also be leadership that may not be as open to it, although I think that's changed a lot today. And then we also have a ton of fragmentation. Across sponsors, there's all these different vendors that sponsors work with, specific projects interests and department interests, and all of these things tend to hinder what can be broader efforts at adoption and disruption. Finally, also willingness to learn, the perspectives. People sometimes just don't want to be bothered with change. They don't want to mess up their routine. They've had enough of this working from home already, and they don't want to change. There's other considerations like operational processes, data access, low infrastructure, so many things. I could go on. And I think you all get the idea. You all face challenges, and innovating in of itself is a challenge. How are we ever going to get to the place where we're actually disrupting and achieving the things that we're hearing about today? And not just achieving them, but achieving them in a broad scale. Well, perspective is a big part of this. And to date, many of our perspectives have been often oversold and underdelivered. And so if you've been on that side of things and you know the hype curve and you've experienced the hype curve, maybe you can just type something into the discussion and or raise a hand and say, yeah, I know exactly what you're talking about. And I think this is important to address. So many times we're shown the future, and we're shown algorithms that can do everything, right? And soon algorithms will be replacing doctors. You remember that one? Oh, this algorithm that's beat the Go champion. This one's going to be the one that's going to put all the doctors out of business. Well, it's a little bit of overselling and maybe a bit of fear mongering, but in the end, the actual delivery of value comes in the realization and the application of the work that it's involved with. And so, Watson was an early name that was out there. And, maybe there was a little bit of overselling on Watson. And so people were a little bit disillusioned when they got to it. But in the end, it's part of the process. And it's a necessary part of the process, because what happens is you get the hype cycle that eventually overlays the chasm. And you get to this point of this disillusionment. But the perspective is the key to overcoming the disillusionment and crossing the chasm. The perspective is key to really saying, you know what? I'm going to try that whole Netflix thing, when you're so used to going to Blockbuster and picking out your video. And you sign up and you get Netflix DVDs in the mail. And all of a sudden, a shift is occurring. More and more people, hey, this thing is kind of cool. I don't even have to leave my house anymore. And a whole new industry opens up, right? The industry was there, but the way it was is no longer there. And in pharma, we're starting to see some of these early changes. We're not quite to the place where pharma is totally disrupted, but there's a lot of things coming down the pike. So perspectives, they're key. How do we help our perspectives? I think a big part of that is curiosity. Curiosity promotes new perspectives and opens our minds to new possibilities. Our current thinking oftentimes is limited by, well, this is the way it is or the way it was. But achievement of disruption really relies and hinges on not just the convergence of new capabilities, but our perspective and willingness to embrace them. And I think these are driven by some of those thoughts that say, I wonder, what would be possible if, and fill in the blank there, what would be possible if we didn't have challenges with data access? What would be possible if we could get drug to patients manufactured remotely? You think about all the challenges with central manufacturing that we faced, all the different items that have been disrupted with COVID, and how they have started to ideate on how to change and how to create new capabilities or embrace new technology. And so starting out with that thought, I wonder, what would be possible? Curiosity is key, and also understanding community is key. Community having the willingness to go forward, to adopt new things, to try new ways of doing what we do. People need to be amenable. It's important we foster open cultures, that we adopt growth mindsets. People are number one hindrances, actually, to adoption of disruption and things that will actually be good for patients. I mean, we can say it's the processes, we can say it's the tools and technology. Oftentimes, it's the people. And so it's important that we continue to work with people and continue ourselves to be open and try new things and not be afraid of change, not be afraid of disruption, but embrace the good that can come with it. Processes, obviously, and the way we work has to be tailored to integrate, to take on the new, to get practical application, meaningful integration, so that the day-to-day work that you do is not changed for the worse, but it's changed for the better. And then the tools and technology, I think that's all there. That's the easy part. They need to be fit for purpose, not onerous, agile, forward compatible. I think we're approaching that place where this is more readily accessible than ever before. And that's a really important understanding. I'm going to get to that tools piece in a moment. Before I do, we're going to talk about overcoming roadblocks, really taking that perspective. Today, it's easier to get from concept to creation, and this is part of what I help others do. Really dream in that space, in that blue sky. I wonder if, and understand where are the possibilities if our roadblocks are removed. Sky's the limit. But then to get from there to a concrete roadmap that you can actually walk out, it requires a process to refine, to distill, to get to this minimum viable product, this MVP of an idea, and to really take that and to test it, similar to what we do in drug development, clinical research. But to do that with things that are disruptive in the way we work, and not just what we work on, the drug, patients. I mentioned to you tools before being an important part of this. I wanted to highlight real change and disruption in data and data-related capabilities are so easily within reach today. Here's an example of an actual project where the minimum viable product set to deliver in 1 month. Provisioning of a cloud-based service is basically 24 hours to turn on. And then the connection of all the data within trials coming within 4 weeks. Full access across trials, I'm talking about multiple trials, mid-sized pharma, available in 3 months. This is the kind of change that unlocks new capabilities for companies. You think about how many people it takes to get statistical assessments on cross-trial data. Even today, it still can be quite challenging with all the different systems we have. But here is essentially a system to create a web across systems and a web across data sources. And you're talking about getting to MVP and really roll out training and all that within 5 to 6 months. That's big. So why is it that we're stuck in the way we think when there's so much that can happen? And here's the part where I want to hear from you. There's a lot that's emerging and converging in pharma. What areas do you see as your top thought, what's going to change in the next 10 years? But what areas is it you think are going to make the most impact? And so I'm going to start and ask, actually, Oscar, if you can speak to this first. And you may be still behind the camera there, but I just wanted to ask your opinion.
Yeah, I'm here. Can I ask you to be more specific on your question?
Yeah. With all of the different changes that are happening that we're seeing, and we've heard a lot of them over the last 48 hours essentially, right? What are some of the top areas that strike you as the biggest potential disruptors in pharma for the next 5 to 10 years?
I think we're going through a very disruptive period, but to be fair and looking at my own experience, I see that as mostly in the balance positive than negative. So it's a positive disruption. Mm-hmm. I think that we're getting into a situation where, although we are talking about post-COVID, I think that we have to eliminate that term and say this is the new world. And the disruption means, and I can tell you right now, something that is happening to me, which is sometimes the best way to talk about disruption. Obviously, my work is very disrupted because I was used to go to my office every day. I'm not going there today. I'm working from home. And this week I had 3 different virtual meetings going on. And I was working, a couple of days I was there, but the rest here. And at the end of the day, I'm much more effective. And that's also what I'm seeing on other people that decide on their own when they stay home, when they go anywhere. We're able now to attend, again, 3 meetings simultaneously, virtual meetings, and this is spectacular. And I was able to, I just mentioned this morning, to the director of CBER, which is the agency at the FDA that is going to review our IND filings. And this is spectacular. And the way we interact with key opinion leaders, my learning curve is moving up very quickly. And I see that also in my colleagues. I think that the entire industry is also becoming more effective. I think that having a patient attending our clinical trials and having to travel back and forth from home to a hospital just to take a blood draw and spend the entire day just for that is totally inefficient. It's going to cost us more, and we know that. But we're going to start sending probably forever a nurse that is going to do all that work. And you mentioned that sometimes, maybe she has to take a small centrifuge and do that in the home of the patient with either a battery or connecting to the electrical outlet there. It doesn't matter, but what I can tell you is that many of the efficiencies that we're learning are going to stay. So in general, again, it's a very, very positive disruption. My view.
Great. That's great. Yeah, that's fantastic. I want to hear also from some of those who are on the call today and just listening in. I have a point for discussion just to close up, but I wanted to, ask this question. What areas do you see as top areas as disrupting clinical trial research? Virtualization is definitely top on the list with what we're experiencing today. But 5-10 years out, where do you think we're going to go? Please welcome, in the discussion to enter your question or thought there or into the Q&A, and we'll look for your comment there. I'll give you guys a moment just to find that and put in one of your thoughts there. Likewise, if you want to ask a question over the phone, Sam, I'm sure you can help facilitate that.
Absolutely, yeah. If you have any remarks in regards to Dave's presentation, you can use the boxes to the right. Otherwise, we can always connect you with David via email. He is the founder of Biopharmatics. If Dr. Jeffrey's in the room, I know yesterday you had, I think, a similar remark regarding change, Dr. Jeffrey, if you're still here. But no, I appreciate your time again, David, and thank you for presenting. And I guess we will all transfer over to the next room now for Vanny.
Thank you.
Thank you.